Welcome back to Uncovering Bailey in Love with Snazzy Surgeon. We're diving into something really important today, something we face every day in practice.
Mhm.
What dictates how our breast cancer patients do after we've, well, you know, done our part in the OR?
Prognosis, right. It's a big one.
Huge.
Yeah.
And for everyone listening out there, I think getting this is like the cornerstone of everything that comes next.
Oh, absolutely. Adjuvant therapies, how we watch them, those tough talks we have with patients and families.
You're spot on.
We might do the surgery, but the long game,
Right.
it's way more than just what we see on the table. It's about the disease itself and the person in front of us. It's complicated.
Totally. Okay, so let's break it down. Let's
Yeah.
start with, I guess, the tumor, right?
Sure.
Like size. That's got to be a biggie.
It is. I mean, generally, the bigger it is when they come to us.
Yeah.
Usually that means it's not as good news.
Not as good news.
Mhm.
But it's not just what we feel, right?
No. It's the whole picture. Pathological staging, you know that.
Of course, of course. So is it just in the breast? Is it in the nodes? Has it spread further? That kind of thing.
Exactly. And then zoom in even more, right? Under the microscope,
Okay.
the grade, how messed up those cells look, how fast they're growing,
Higher grade, worse prognosis.
usually. And sometimes, well, they're just nasty from the get-go.
Like.
Metaplastic carcinoma, that one always makes me nervous.
I hear you. They don't always play by the rules.
And then there's lymphovascular invasion. Uh-oh. If we see tumor cells in the vessels, that's a bad sign.
Yeah, it means it's thinking about spreading.
Yeah.
And even if it's not full-blown invasive cancer, like DCIS,
Right.
a big area of that can sometimes be a sign that, something worse is brewing.
It's all connected.
It is.
Right.
And of course, the lymph nodes. Axillary involvement. That's still such a huge part of the picture.
Huge.
If we see it there, the risk of it coming back goes way up.
Way up. And the more nodes involved, the worse it gets.
Right. Like 4 or more positive nodes?
Compared to just 1 to 3.
Yeah.
Night and day in terms of prognosis.
And then there's all the molecular stuff.
Ah, yes. HER2, triple negative.
Those tend to be tougher, right, than the hormone-positive HER2-negative cancers.
More often than not.
Okay, so we've talked about the tumor, but what about the patient themselves?
Ah, now that's where things can get tricky.
Tricky how?
You'd think younger would be better, right?
I guess so, yeah.
But sometimes younger patients, premenopausal women, they actually have a worse prognosis.
Really? That doesn't seem right.
I know. They're still figuring out exactly why, but maybe the cancer is just more aggressive in younger people.
Interesting.
And then genetics. We can't forget about that.
Oh, right. BRCA mutations, family history,
Yeah.
those play a role.
For sure. And if they've had breast cancer before,
Uh-oh.
that changes things too.
It's like a whole web of things.
It is. And then, there's more. Lifestyle. If they're obese, don't exercise much.
Doesn't help, does it?
Not really.
It all adds up.
And the most important thing, whether they stick with the whole treatment plan,
Makes sense.
adjuvant therapy makes a whole world of difference.
So, okay. We've got all this info. We've done the surgery. How do we put it all together to figure out what's next?
Well, there's a tool for that.
There is
The Nottingham Prognostic Index.
the MPI.
Right. It pulls together the key stuff. Tumor size, lymph node involvement, grade.
Okay.
It's a formula. NPI equals, 0.2 times the tumor size in centimeters, plus the nodal stage, plus the tumor grade.
So it takes all the big players and crunches them into a number.
Exactly.
What do we do with that number?
It tells us their prognosis.
How so?
Well, an NPI of 2.4 or less, that's excellent.
Excellent.
Between 2.4 and 3.4, that's good.
Good.
Then you have moderate, between 3.4 and 5.4.
And above 5.4.
That's poor.
So it gives us a way to, categorize things.
Yeah. A way to make sense of it all.
Okay, so it really is a multifaceted thing. We have
Yeah.
to think about the tumor, its biology, the patient themselves, and then use tools like the MPI to synthesize it all.
It's like piecing together a puzzle.
It is. And the more pieces we have, the better we can guide our patients.
Exactly.
Well, this has been a great deep dive. Thanks for joining us.
My pleasure.
And for everyone listening, thanks for tuning in to Uncovering Bailey in Love with Snazzy Surgeon. We'll see you next time.